All right. Well, hello to my LPN students. Have another video for you, another skill that we have. And this is immediate care of the newborn. And so I'll just be quickly going through the steps of that. You would have your, normal PPE on. So I would have my gown on, my mask on, and all that regular stuff. But I do have my gloves on. But you would have all the appropriate PPE on that you needed. And so this is going to be care that we give to the baby as soon as the baby is born. So as soon as the doctor, or the healthcare provider has that baby out and reaches that baby to you, you want to definitely mark the time of birth for sure. We're going to hold the baby down to facilitate drainage because there is fluid in the lungs here. And so we're going to hold the baby kind of down all the time that we may have it. And so that kind of facilitates drainage that way. And the first thing that we want to do is prevent hypoxia. So, most of the time the babies are crying when they come out. And so they're getting some oxygenation going. However, if they're not, we want to make sure that we clear the airway out and get them crying, stimulate them to get that oxygen process going. So the first thing, besides holding them down to facilitate drainage, we're going to press the bulb syringe, and that is a critical criteria there. You want to make sure that you do depress that before you put it in the baby's nose or mouth. And we're just going to put that in the back of their throat, and we're just going to sweep that across the back of the throat and just suck any fluids out there. And so you're going to discard that. And you would do that however many times you needed to. Make sure you get between the cheeks and gums. All right, and then you're going to go in the nose and suction out the nose. Now, yes, babies are notorious nose breathers. However, when they come out and they're crying, they're screaming through their mouth. They're bringing air in, inhaling through the mouth. So I always recommend do the mouth first in this case. Later, then we kind of concentrate more on the nasal passageway because they are notorious nose breathers. But when they're crying, and that's what we're trying to get them to do. So we're going to suction the mouth first. Pay attention that when you do suction the nose, though, we have a form that you'll fill out, and I'll talk about this in a minute. It's called the APGAR score, and one of the sections on there is reflex irritability. So just remember, if the baby sneezes or anything like that when you suction the nose, that is a good sign for reflex irritability. So just bear that in mind as you do that. And the suctioning process will keep on going throughout, this process. All of this is happening really fast simultaneously. So just make sure you're constantly monitoring the airway, the baby, breathing, crying, his respiratory rate and all that. And we'll talk more about that. So first, prevent hypoxia, and that's get that oxygenation going. Okay, second thing then is prevent cold stress. So we definitely want to get our baby and we want to dry our baby off really, really good. So all over, we want to dry that baby off. We want to get them over there to that warmer. Again, keep that warmer tilted so it facilitates drainage of the fluids out of the lungs. And then we're going to get our baby wrapped up. Don't wrap them really tight around the chest initially. Later on we will, but initially we don't want to impede respiratory effort at all in any way, shape, fashion, or form. And you're going to have to keep, looking here, assessing different things. So just don't wrap them really tight. Just kind of wrap them to keep them warm, and that's good enough. Okay, so then we'll say at this point in time, let's say it took us 1 minute post-birth to get to this point. And so at this point, you do an APGAR score. So you do an APGAR score at 1 minute and 5 minutes. So you do an APGAR score at 1 minute and 5 minutes post-birth. I'm going to talk about it in detail at the 5-minute mark. So we're going to carry on from here, but we would do our APGAR score, 1 minute APGAR score. All right, so then next I'm going to look at the umbilical cord. And like I said, I've got to give you this in steps so you can learn it all, but this is all going on simultaneously. It's rapid. It's very rapid. So you want to make sure that the cord is not bleeding. There's no oozing of blood. If there is any oozing of blood, you want to take another clamp and just simply put it on above the clamp that the healthcare provider has put on and just squeeze that closed, and that should stop any oozing of blood there. You want to make sure that there are 2 arteries in 1 vein. I always remember this by the name, the lady's name, Ava, AVA, so 2 arteries and 1 vein. And that is very important. If there is not, if you do not see 2 arteries, and the arteries are smaller, the vein is larger, then you want to make sure that you notify the healthcare provider, because that is a good possibility of a congenital heart defect or something serious going on there. So that is a very serious thing. So after that, you probably want to, put some triple dye on it eventually, and that just protects the cord, kills any microorganisms or stuff like that. All right, so now we're going to say that we are at 5 minutes post-birth, and so now we would do our 5-minute APGAR score. And so there's 5 categories there, and you're going to score it either from 0 to 2 points. So one of the categories is color, and I always go with color, start with color, because it is the first thing that you can see. As soon as the baby comes out, bang, you can look at the color and you can assess that really quickly. So what we're looking for is I want a nice pink baby overall, and if the baby is pink, good skin color, hands and feet as well, they would get a score of 2 for that. Now that usually doesn't happen because most of the babies born will have acrocyanosis, and simply what that is a bluish discoloration of the palms of the hands and the soles of the feet. That is not an emergency. It's not a lack of oxygenation. There's nothing that you need to do, no intervention. It's just most babies are born that way. But having said that, if they do have the acrocyanosis, which most will, then you would give them a score of 1 for color. Then, of course, if they are, pale looking, pasty gray, ashen gray, if they are yellow, if they are bluish, any of those scores, we would give a 0 for that. So that's how you would score color. All right, so then obviously the next thing that we're going to look at is, respiratory or heart, either one. So, and like I said, you're doing this simultaneously, so it's going really fast, but I'll go with respiratory. So respiratory, I want to make sure that the baby has a good, strong cry. If I'm hearing a good, strong cry from this little fella, that's a score of 2. Respiratory rate above 30, so 30 to 60 a minute, that's a 2. If this baby has a weak, whiny cry, he's just kind of whimpering and weak in cry and stuff like that, I might give him a 1. If the respiratory rate is less than 30, I would give him 1. If I see any nasal flaring, that's his little nose is pumping out every time he breathes, that means he's struggling. He's trying to pull in as much air as he can, and he is struggling to breathe. So I'm going to give him 1 for that. If I see any intercostal retraction, so the baby is breathing so hard that the flesh part in between the ribs is literally pulling in, and I can see that. A substernal retraction, here I can see that sinking in when the baby is breathing. He is pulling enormously hard to breathe, so I'm going to give him a score of 1 for that. So if I see one of those, any of those, all of those, a score of 1. Now obviously then I want to take an intervention. I'm going to start blow-by oxygen, so I'm just going to get some oxygen and start blowing it across the face. I'm going to continue to concentrate on suctioning, okay, and if necessary, deep suctioning. So if that becomes, necessary, then we will do that. We will do whatever we need to do. All right. So then the next thing I'm going to look at is the heart rate, and the heart rate is pretty easy. Again, if they have no heart rate, we'd be coding the baby, obviously, but we would score that a 0. Then if the baby's heart rate is less than 100, we're going to give them a 1 for that. All right, so less than 100 gets a 1. If they're above 100 beats per minute, then we're going to give them a 2 for that, and that's really good. And usually babies, I think, are, when they're born, they're about 120 to 140, something like that as the norm. But a quick way, I know your book is going to say listen for a full minute, and you should do that eventually, but this is a way that we can quick do the APGAR score. Yes, definitely, you want to use the stethoscope. and you definitely want to listen to heart rate and lung sound. But at this point, we're trying to get that Apgar score really quick. So what you can do is just grab the belly button, the umbilical cord, and you can still, at this moment, feel the artery beating through there, and so you can feel that. And so what you're going to do is just count how many beats that you feel in 6 seconds, and then times that number by 10. So if I get 12 beats, because it's going to be rapid, that's what we expect in a normal baby, healthy baby. And so let's say I get 12 pulsations here in 6 seconds. Then I'm going to take that 12 times that by 10, that's 120, so my baby is good to go. All right, so then the next things that we're going to look at is like, we'll look at reflex irritability, and I talked about that. The reflex irritability is where, you know, the baby is reacting, it's reflexes, it's reacting to what you're doing to it. So if you put something up the nose, and you trigger the sneeze reflex, so the baby gives you a little sneeze or something, note that, that's good reflex irritability, so we would give a score of 2. You know, when we're trying to oxygenate the baby, if the baby was not crying when he came out, I'm going to vigorously stimulate him. So I'm going to clear that airway first, and then I'm going to stimulate the back, rub vigorously, or I've seen some do this, okay, tap the bottom of the foot, and that irritates them and they start crying. That's good reflex irritability, so you get a score of 2 for that. You know, if we give them the vitamin K shot, which we'll talk about here in a moment, and the baby starts crying, you know, that's a score of 2. You know, if you pull the legs out and let go and the baby pulls back, that's good reflex irritability. The reflexes are working, so that's all good stuff. Okay, so then the last one is muscle tone. And muscle tone is just, I mostly look at the degree of flexion in the elbows and in the knees, the baby's knees. So if we're looking at this baby, all right, so I want my baby to have flexion up here. I want these hands to be up here around the face and stuff like that. And he's trying to figure things out. And he's getting them all over his face and sticking them in his eyes and, you know, his nose and all that kind of stuff. So I expect that to be up there. If I take his wrists and pull them down and let go, I expect him to pull those hands back up there. Legs the same way. I expect to see my baby kind of up like this, a good degree of flexion there. And if I stretch the leg out, okay, and, you know, kind of stretch it out and let go, then I expect the baby to draw back up there again. So, you know, a good flexion like this and the legs like this, okay, that's going to be a score of 2. That's good flexion. All right, our muscle tone. If I see this baby right here as is, okay, so this baby, there's some flexion here in the elbow, but not a lot, okay, maybe about, what, 30 degrees there? That's not good flexion. 30 degrees maybe here. A fair amount here, but not so much here, okay, not so much with this knee here. So I would give that baby a 2, or excuse me, a 1, because they have some flexion, but they don't have a great deal of flexion like I expected to see in this healthy baby. And then if they come out and they're flaccid and they're not moving, they're not interacting, you know, and doing anything, then score of 0. And obviously something is dramatically wrong with this baby, and you would need to provide interventions accordingly. But that's another section altogether. Okay, so finishing immediate care then. After that, we're going to look, so that is the Apgar score. Oh, excuse me, I'll finish up one more thing on the Apgar score. Usually at 1 minute, we want them around 7 to 8 on the Apgar score, and that would be normal. At 5 minute, I want them at least a 9. Rarely will you get a 10 because of that acrocyanosis that I talked about, of the blueness of the palms of the hands, soles of the feet. So most of the time they will only get a 9. I have seen one baby that we gave a 10 that was nice and pretty and pink skinned all over. But we did, that's the only one I've ever seen. And so, you know, if we're down below that, that's danger levels below that, you need to provide interventions, like I said, blow by oxygens, make sure they're suctioned out good. check that heart rate, listen to the heart, lung sounds, and all that kind of stuff. And then if they're down 3 or below that, that's that is severe, and there's definitely a problem going on, and need to provide interventions as needed. So moving on from there, though. So then we're going to do the normal routine stuff that you're probably mostly familiar with. So we want to get height and weight, chest and head circumferences. So you're going to weigh or measure from the crown of the head to the soles of the feet. Get that measurement. Measure across the chest. You want to go right across the nipple area. Do 2. Usually 1 on inspiration, 1 on expiration, and average the 2. That'll give you a good average. And then, of course, you're going to do the head circumference and make sure that they are within the normal limits. For the normal limits, look in your textbook. That's what I want you to do. That's your job with this, is look in the textbook and get your normal limits from there. All right, so after that, we want to make sure that the plumbing system is working. And that the thermal regulation system is working. So we want to get a temperature. Now, there are some facilities, I think, around here still doing the rectal temp. And so if that be the case, make sure that you lubricate first and that you only insert it about approximately a ½ inch, and that would be the maximum amount into the rectum, and that is all. Most everybody has moved away from the rectal temps, I think, and just doing like axillary or something like that. But regardless of what way, and know your facility's policy, regardless, just know that you have to get the temperature of the baby, and we have to monitor that and make sure their thermal regulation unit or system is kicking in and keeping them warm. So the next thing then, making sure their plumbing is working, you want to look for that first void. And so you want to talk to mom about this, because mom might be the one that changes that diaper. So you want to make sure that mom looks carefully. Now, the first void may be a very, very small amount, so they've got to look carefully at each diaper that they take off, and that they have to notify you or let you see it. Okay, so you want to see it. I always tell them, I want to see it. So ring for me, call for me, and let me come down and look. Now, also tell mom, though, with the first void, with girls, they can be a little bit of a pink tinge to that, and that's uric acid crystals. It tends to happen more in the females than the males. So let mom know that if she does see that little bit of pink tinge in there with the first urine or so, that's uric acid crystals, not a problem. They're not bleeding internally or anything like that. It can scare new moms that don't know about this. So you want to explain that to them. So tell them that is normal, just let you see it. And second, then we're looking for the first passage of stool, meconium stool. Meconium stool is a black tarry to a greenish, dark greenish color there, and it's tarry looking. So again, explain that to mom, that you need to see that, for her not to throw that away, that you need to see it, and make sure that their bowels are moving, but also let mom know that tarry, sticky, look to it, black, is not bleeding, not internal bleeding. Everybody knows that black tarry stool means, you're bleeding, in the intestines, and in this case, it's not so let mom know so it doesn't scare her. All right, so then we're going to move from there on to vitamin K shot. Now, we've got to give a vitamin K shot, usually about ½ to 1 milligram of vitamin K, and that'll be a facility policy. So ½ to 1 milligram of vitamin K, and we give that vitamin K to jumpstart their clotting factor, their clotting system. The liver, the liver has to, get started, get working, get regulated to start producing that, and it may take a couple of weeks. So the baby would be in danger of bleeding without us jump starting them with vitamin K. So we'll give them a little bit of vitamin K there. Usually about a 5/8 inch, 27 gauge needle, 5/8 inch length, 27 gauge. It's a IM injection, so we're going to give that in the vastus lateralis, which is and you guys know what that muscle is, you should. And so that's that. You can't miss it. It's the big muscle right there that pulses out of the baby's thigh there, so you really can't miss it. And so it is an IM injection, and it is given at a 90-degree angle. All right, so once we do that, then you want to make sure that you tag the baby to the mom. Now, I know these are old, but I'm just not going to spend money on buying those newer fancy things, but whatever your facility uses, the electronic ones, whatever they have, you want to make sure that you apply those appropriately to the baby and appropriately identify the mom to that baby. So make sure any numbers involved, that they're the same, that we can make sure that that baby is identified to that mother and before they leave the room. So then the next thing we want to do is we want to wash off the baby's soles of the feet. They're going to have that vernix caseosa on there, the white cream cheesy like substance. And so we want to wash that off really good. And then we're going to take our ink pad, and you're going to put the ink pad against the baby's foot and then put that to the birth record. Also, you want to do mom's right index finger, and so do that, and that helps us tag that baby to that mother also. All right, and then after that, one last thing, you want to take some clean 4x4s, and you're just going to wipe off the baby's eye, okay, and just kind of get that blood and stuff away from there. And then what we're going to do is just hold the conjunctiva, go from the inner canthus to the outer canthus, and just spread a bead of this ointment, antibiotic ointment, in the eyes. It's usually about a 0.5% solution of erythromycin, and I think there's also 1% of tetracycline. It's a thick ointment that you're going to spread down in the lower conjunctiva there. And then, of course, the baby's going to cry on you. That's good reflex irritability. He's going to close his eyes and squint. And so some of it will run out, over there. That's fine. Let that go. Let that just come out of there. Some will, gently rub around the eyes. Now, very gently rub on the eyelids just to kind of move that antibiotic ointment around. And that prevents the baby from getting an eye infection where he's come through mom's birth canal. So then leave that on there for about a minute or so, and then just the real big excess though, just kind of dab that off a little bit, but leave the eyes, if they're moist with it, wet with it, that's fine, that's good. Okay, and so that's pretty much the immediate care of the newborn. And so I will be posting a handout to go along with this that will have more details in it. So it'll have a few more finer details in there about things. And so get the handout, print that off first, watch the video, and you should be good to go. If you have any questions, just get in contact with me. And all right, I miss you all. Wish I could see you all. But take care. And I think maybe I have one more video to do for you on bathing the newborn, and I think that's our last. So, all right, that's it.